Well, good afternoon, everyone. My name's Linda Hughes. I'm Chair of the Alberta Health Services Board, and I'd like to welcome you all to our May Public Board meeting. We have a lot on the agenda today, including some comments and updates from President and CEO Dr. Verna Yu about our recent work in the area of diversity and inclusion. But first, I'd like to tell you about a very important partnership between AHS and Alberta Children's Hospital Foundation to improve access to child and adolescent mental health in Calgary. Last week, AHS and the Alberta Children's Hospital Foundation announced that together we will be building a community-based centre dedicated to meeting the mental health needs of children and teens. When this new centre is built, patients and families will benefit from a broad spectrum of programs and services provided by multidisciplinary teams to help stabilize and manage mental illness and addiction, and in many cases prevent hospitalization. Patients and families have told us they want care provided in the community rather than in an acute care setting. And by offering these services in the community, family-centered care, support, and treatment will be provided in a more appropriate and convenient location for parents. The centre will provide 3 services to help young people and their families better identify and manage challenges before they escalate into crises. These 3 services include walk-in, intensive treatment, and day program hospital. We are confident this new centre will provide the right services to young people experiencing mental health concerns in giving them the best start possible. Thank you to the Alberta Children's Hospital Foundation for helping to make this happen, and to everyone who's been involved. Construction for this building is expected to be completed in late 2021, and we look forward to the positive impact it will make to young people in our community and their families. On another positive note, I'd like to congratulate 3 inner-city healthcare initiatives that were singled out by the Health Quality Council of Alberta to be recognized for Patient Experience Awards. The first was to the Alberta Conservative Kidney Management Clinical Pathway and the Alberta Kidney Council, which were recognized for the development of their interactive, web-based Conservative Kidney Management Clinical Pathway, designed in collaboration with patients, families, and multidisciplinary healthcare providers. The second was to City Centre Team Mobile Paramedic Program, part of the Calgary Zone EMS Community Paramedic Program, that provides timely, individualized care to people living with homelessness in shelters, harm reduction sites, encampments, and on the street. And finally, the Inner City Health and Wellness Program, based at the Royal Alexandra Hospital in Edmonton, was awarded for its program providing care to patients with active substance abuse or disorders and to those who may be dealing with social inequity. Congratulations to all 3 of those teams. Now, before I turn the mic over to Verna, has everyone seen the agenda? Could I ask someone to move approval? Hugh, seconded. David, all in favor? Thank you for that. Is there any conflict of interest? Would anyone like to declare a conflict of interest? Hearing none, move along. And you've all seen the minutes for our last meeting, March 21st. Has everyone seen the minutes? Could someone move approval? Marlis, seconded by Richard. Thank you. Thank you very much. And with that, I'll turn it over to Verna.
Thanks very much, Linda, and good afternoon to everyone. As Linda mentioned, I have some news to share from one of our senior leaders, but first I'd like to spend a few minutes talking about diversity and inclusion. They're both very big areas of focus for our organization. As a health system that serves more than 4 million people, Alberta Health Services has a responsibility to ensure that everyone who comes to us for care, as well as everybody who works at AHS, feels welcomed and accepted for who they are. Our AHS values state we need to treat people with dignity and respect always, regardless of race, religious beliefs, color, gender, gender identity, gender expression, physical or mental disability, age, language, ancestry, marital or family status, or sexual orientation. And that core belief that we must treat others the way we wish to be treated ourselves is embedded in all aspects of our work. I'd like to share with you details about some recent AHS efforts to ensure our health system is inclusive of everyone. Earlier this month, AHS launched a diversity and inclusion census across the organization to understand the diversity of our workforce and the level of inclusion felt within AHS. The census is led by the Canadian Centre of Diversity and Inclusion on behalf of AHS and remains open until mid-June. It's strictly voluntary, and the answers are anonymous, confidential, and secure. We expect the responses will help us develop a deeper understanding of the diversity of our people, which is essential as we strive to create more inclusive places for everyone, including patients, families, and visitors. We've made progress over this front over the years. For instance, developing ceremony protocols for Indigenous patients and families, providing multi-faith spaces in our facilities, and expanding our translation and interpretation services. Next month, we'll reach another milestone. Our staff have been participating in Pride events in various ways and capacities over the years. But next month, I'm proud to say that the Royal Alexandra Hospital will become the first AHS facility to host an official Pride Festival event. The public kickoff event will take place June 11th at noon in the main atrium of the hospital's active treatment center, and it will be followed by a series of 30-minute education sessions in the Robin Center auditorium throughout the afternoon. It's open to all staff and the public. This event will underscore the work that AHS has done to date to create safer and more inclusive environments for all AHS staff and patients, and in particular, those of sexual and gender minorities. Marnie Panis, a senior advisor with our diversity and inclusion team, will MC the event, and you may have seen her profiled recently on Globo's Edmonton's Women of Vision series. I'd like to show a segment of that series because Marnie's comments speak volumes about her experience as a transgender woman and what it means to work for an organization that accepts people for who they are. Take a look.
She was once a highly competitive runner
It's been a really important part of my journey.
until hormone therapy changed her body.
I run slower than ever, it takes me a lot longer, and I get a lot more sore a lot quickly. But I love my running more because I enjoy the experience.
Over 40 years of feeling she didn't fit in, Marnie Panis turned to running as an outlet.
And I've seen some parts of the world that I never would have seen before, and I've seen parts within myself that I would have not experienced before because I can do it on my own, on my terms. And I think that's more of my metaphor for my whole life.
As a transgender woman,
Because basically what they're asking is, do you have a penis or a vagina?
Marnie has been a strong voice for the sexual and gender minority community.
You're sharing your story. It is how we impact change. It is how we get to know each other as humans beyond the labels and beyond the judgments that often are put on with those labels. Okay, I know you have thoughts. Anybody want to share them? It's very difficult to discriminate against somebody that you have a relationship with.
From a young age, Marnie wasn't comfortable in her own skin.
I didn't hear the word transgender until I was in my 30s, so I never had the language to articulate how I felt or who I was.
Raised in a Catholic family, she lived a double life.
And I remember even thinking, if I ever get into an accident, don't phone 911 because I wouldn't want my family to find out that way.
She got married and became a father, but their twins were born 3.5 months prematurely. And after 5 months, one of them died.
When you're holding your son as he takes his last few breaths in your arms, quite literally, he teaches you something about living life without regret. And, my boys taught me more about living authentically in those few moments than I think I've learned at any other part of my life.
Marnie went back to school and started working with families at the Stollery Children's Hospital and then with Alberta Health Services.
I transitioned because I worked here, because I worked in an environment that was surrounded by people who were in the business to care about each other and their patients and families, and I really felt that care for me.
And when she was asked to help a transgender child using school washrooms,
There is no reason for these school boards not to do the right thing now.
Marnie became an advocate. She also helped to change laws.
My name is Marnie. I co-lead the diversity inclusion work at one of Canada's largest employers.
Testifying before the Senate to amend Canada's Human Rights Act.
We are sorry.
and being part of the committee that drafted Prime Minister Trudeau's apology to the LGBTQ2 community. But taking this journey has come at a cost, including lost friends and a broken marriage.
My parents haven't been in my life. I haven't spoken to them in 4 years. And, I would give anything to hear my mom call me by my name just once.
Her vision is emboldened by the unconditional acceptance of her son.
Where acceptance and inclusion is just part of the DNA of our society, where nobody has to come out as anything, as anyone. It is just who we are. That to me is a future worth fighting for.
Leslie McDonald, Global Woman of Vision.
AHS is fortunate to have Marnie help guide our diversity and inclusion efforts. Her experiences and insights are invaluable, and her colleagues are empowering the AHS workforce to live our values and promote patient and family-centered care. Our next step is developing a provincial advisory council to advise the organization on health services for all sexually and gender minority people. Public engagement is now underway, and I expect to share more information about that shortly. Now, before I turn the mic back over to Linda, I have some wonderful news to share from Dr. Richard Lewanchuk, our Senior Medical Director of Primary Healthcare. He emailed me last week when he was in the Netherlands, where he was attending the 18th International Congress on Integrated Care, where it brought together healthcare leaders from over 43 countries and numerous health systems within those countries. Prior to the meeting, there were submissions on accomplishments related to health systems that were submitted, and more than 200 submissions were provided from around the world. Alberta Health Services was identified for being one of the top 5 most integrated health systems in the world. These international delegates were very impressed with what's happening in the province in terms of integration and ensuring that all parts of the system and all teams work together to provide seamless care for patients and families. Furthermore, during a real-time vote or a real-time poll of delegates at the Congress, Alberta ranked 2nd in the world, just behind the world leader Netherlands, as the national health system from which the most can learn from. In fact, Dr. Lewanchuk wrote that representatives from Australia, New Zealand, the Netherlands, and Belgium are wanting to make connections with AHS and even come to the province to see firsthand what we are doing. I was pleased to hear about all of this, but I was not surprised because I've encountered similar reactions when I travel outside of Alberta to talk about Alberta Health Services. We are doing exceptional work in this area and continue to do more every day. Last year, the Primary Healthcare Integration Network was launched to support better integration of primary care with acute, emergency, and specialty care, as well as with social care organizations and other key services and programs. Meanwhile, Connect Care, our provincialized electronic medical record system, and our provincialized lab model are going to be great enablers for improving integration when they come on stream. In other words, Alberta Health Services is a world leader in health system integration, and the best is still yet to come. That is great news for Albertans and anyone else who seeks care from Alberta Health Services. So thank you for your time this afternoon.
Thank you, Verna. So if we could move along now and hear from the Governance Committee, Hugh.
Thank you, Madam Chair. The Governance Committee met on May 22nd of 2018. The committee received the Ethics and Compliance 2017-18 Q4 report for discussion and met with the Ethics and Compliance Officer. The committee also received the annual 2017-18 policy report, highlighting the work of the policy group and outlining certain corporate and clinical policies. The committee had a fulsome discussion on the process for the 2019 Accreditation Canada assessment. The Accreditation Canada governance standards were recently released, and the assessments will occur throughout 2019. The committee reviewed a proposed board evaluation survey template for the annual survey of board members, and the evaluations will be circulated in early June and results compiled in the summer. There were no recommendation items for the board's approval today. Thank you.
Thank you, Hugh. And just changing the order of the agenda a little bit, I wonder if we might move to the HRC committee, and Richard is reporting. Thank you.
Thank you. The committee met yesterday, May 30th, We received our regular quarterly report dealing with people results. We also received an update on labor relations matter and discussed the organization's transformation of the performance development process. The committee received a briefing by the VP of HR dealing with our application to remain one of Canada's top 100 employers. I would note that AHS is also one of Alberta's top 70 employers for 2018, as well as one of Canada's top employers for young people in 2018. We are hoping, obviously, for a repeat in this coming year. We expect to hear more information on that in the fall. There were no items that came through the committee for approval of the board. Thank you.
Thank you, Richard. Now, if we could move to Community Engagement Committee and Brenda.
Thank you, Madam Chair. The Community Engagement Committee met on May 23rd, 2018. The committee considered a recommendation for approval of the board regarding the appointment of trustees to foundations. The responsibility to appoint trustees to establish foundations lies with the AHS board. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care in the province. Given the number of appointments, the names will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations as reviewed by the Community Engagement Committee and the Alberta Health Services Board. I so move.
Thank you. Could I have a seconder? Hugh? All in favor? It's passed. Thank you. So Brenda, now could you do the Quality and Safety Committee report?
The Quality and Safety Committee met on May 23rd, 2018. The agenda items typically focus on the three areas of access, quality, and safety. The committee discussed the upcoming Quality and Safety Summit that's scheduled for October 17th and 18th, 2018. It'll be held in Calgary. The summit will focus on tackling local challenges, breaking down silos between clinical areas, and sharing knowledge and successes. The committee received a presentation on exploring access to healthcare in Alberta. The committee discussed how access is a multifaceted topic that includes many areas, such as access to diagnostic testing, specialty services, emergency services, primary care, and continuing care. The committee received for discussion the continuing care audit plan, related audit report, and an update on the continuing care quality plan. The committee also received the Quality and Healthcare Improvement Operational Plan and an update on the Patient First Strategy and on patient experience. The committee also received a patient safety report, and there were no items recommended for board approval. Thank you.
Thank you, Brenda. Now over to you, David, on finance.
Thank you, Madam Chair. The Finance Committee met on May 24th and considered 4 items for recommendation for the approval of the board. First, the fourth quarter investment report. As mandated by AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. The Regional Health Authorities Regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. The committee was presented with the March 31, 2018 fourth quarter investment report and recommended that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below as certified by signed investment compliance certificates from AHS and Phillips Hager North Investment Management. A, as at March 31, 2018, AHS held restricted and unrestricted funds managed by Phillips Hager North Investment Management and Manulife Financial totaling $1.792 billion. B, funds were invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended March 31, 2018 were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from AHS, and Phillips Hager North Investment Management.
Do I have a seconder for that motion? Hugh? All in favor? Passed. Thank you.
Second is with respect to a renewal of an agreement with Dell Canada for end-user devices. With the renewal period for 2018-19, the total expenditures could exceed $90 million. Accordingly, the board has been asked to approve the renewal in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. Total agreement has a combined commitment value greater than $90 million. Accordingly, I move that the Alberta Health Services Board A approve the final renewal term, August 2018 to August 2019, of the agreement with Dell Canada for end-user devices, and B, delegate signing authority of the renewal agreement to the President and Chief Executive Officer.
Thank you. Could I have a seconder? Rob? All in favor? Thank you.
Third is with respect to Year 2, 2017 to 2020 Health Plan and Business Plan, including the 2018-2019 budgeted financial statements. The committee reviewed a draft of the Year 2, 2017 to 20 Health Plan and Business Plan, call that the plan, including the 2018-19 budgeted financial statements, the budget. The committee recommended the board approve the plan and the budget, which included the reserve transactions. Such reserve transactions are in addition to the expenses outlined in the budget. The plan and the budget will be submitted to the Minister of Health for approval. Ministerial approval is, after ministerial approval is received, plan and the budget will be posted on the AHS public website. The committee recommended that the board approve the plan and the budget. Accordingly, I move that the Alberta Health Services Board A approve the Year 2, 2017 to 2020 Health Plan and Business Plan, the plan, including the 2018-19 budgeted financial statements, the budget, which includes the reserve transactions, in the form reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and B, authorize and direct management of Alberta Health Services to deliver the plan and the budget to the Minister of Health for approval, and after receiving such approval, make the plan and the budget available to the public through the Alberta Health Services website.
Thank you. Could I have a seconder? Brenda? All those in favor? Thank you. It's carried.
And as a final matter, the committee considered an authorization for expenses for AHS from April 1, 2018 to August 31, 2018, if the 2018-19 budget for AHS is not approved by June 15. The committee recommended that the board approve the authorization for expenses. Accordingly, I move that if the AHS 2018-2019 budget has not been approved by the Minister of Health by June 15, 2018, the Alberta Health Services Board authorizes AHS to A, incur maximum expenses of $6.35 billion for the period April 1, 2018 to August 31, 2018, and B, incur maximum capital spending of $245 million for the period April 1, 2018 to August 31, 2018.
Thank you. Could I have a seconder? Marlis? All in favor? All that. Back to you again for the Audit Committee.
So the Audit and Risk Committee met on May 24th and again this morning on May 31st, 2018. Standard practice is that the Office of the Auditor General and KPMG are guests at the meeting in their role as external auditors of AHS. On May 24th, the committee reviewed drafts of the annual report and year-end financial statements. In addition, the committee received the Legal and Privacy Annual Report, a Risk Management Report, and updates on the insurance program. On May 31st, the committee received the Auditor General Report to the Audit and Risk Committee for the year ended March 31, 2018. The committee received 3 items to consider for recommendation for board approval. First was with respect to Enterprise Risk Management Policy. The committee received a refreshed Enterprise Risk Management Policy for recommendation for board approval. AHS has made significant progress in advancing its enterprise risk management maturity since the current policy was developed in 2009-2010. The updated policy reflects this maturity and continuous improvement. The Audit and Risk Committee recommended the Alberta Health Services Board approve the Enterprise Risk Management Policy. Accordingly, I move that the Alberta Health Services Board approve the Enterprise Risk Management Policy in the form reviewed by the committee and the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable.
Thank you. Can I have a seconder? Rob? All in favor? That's carried. Thank you.
Secondly, the committee reviewed a final draft of the AHS 2017-2018 annual report and recommended that the Alberta Health Services Board approve the annual report. Accordingly, I move that the Alberta Health Services Board A, approve the AHS 2017-2018 annual report in the form reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary and advisable, and B, authorize and direct management of Alberta Health Services to deliver the annual report to the Minister of Health and to later make the annual report available to the public through the Alberta Health Services website.
Thank you. And a seconder? Brenda? All in favor? Thank you.
Thirdly, the committee reviewed a final version of the March 31, 2018 Consolidated Financial Statements, the establishment of internally restricted surplus for future purposes, and the financial statement discussion and analysis. The committee recommended the board approve those items. Accordingly, I move that the Alberta Health Services Board, 1, approve the internal restriction of A, $817.16 million to represent the amount of unrestricted surplus invested in tangible capital assets as at March 31, 2018 and not available for any other purpose. 2, approve the internally restricted surplus for future purposes as at March 31, 2018 of A, $124.525 million to represent the amount of unrestricted surplus related to ancillary services. B, $34.835 million to represent the amount of unrestricted surplus related to insurance equity requirements and not available for any other purpose. C, $41.395 million to represent the amount of unrestricted surplus related to foundations and not available for any other purpose. And D, $36.421 million for other defined initiatives. 3, approve the AHSA Consolidated Financial Statements for the year ended March 31, 2018 as reviewed by the board. And B, financial statement discussion and analysis for the year ended March 31, 2018, both for inclusion in the AHS 2017-2018 annual report and both in substantially the form reviewed by the board with such non-substantive changes that management of AHS considers necessary or advisable are hereby approved. And 4, authorize and direct management of AHS to deliver the consolidated financial statements and financial statement discussion and analysis to Alberta Health and to later make them available to the public through the Alberta Health Services website.
Thank you. Can I have a seconder? Hugh? All in favor? Thank you. And with that, we're concluded. Thank you, David, for all that reading. Excellent. All right, we're concluded. Good afternoon.